Good.
So I'll just have your name.
Yeah, sure. So I'm Florian Honeyball. I'm medical oncologist at Dubbo Health Service.
So can you just give me a bit of background? How did you become a medical oncologist in the first place?
Well, the story to becoming a medical oncologist, in my case, is a bit serendipitous actually. I'd studied really hard trying to brown nose the right surgeons to get onto a surgical training program, and then through internship and residency found out that I actually didn't like theatres that much and really preferred my time on the wards. And as part of what I thought was going to be my surgical training, I did a medical oncology term as a resident to get a little bit of insight to the other side of after the surgery, what happens. And I loved it. And I guess here I am almost 15 years later as a medical oncologist. So very happy that I made that choice, and I think it does fit my personality quite nicely. So much better out of theatres.
Very good. And so you made, the journey led you to Dubbo. Could you just describe how you came to be in the position to work in Dubbo?
Yeah, so Dubbo, again, is a little bit of a chance discovery for both me and my wife. As an intern, I applied to Royal Prince Alfred Hospital, and it just so happened that Dubbo was the country hospital which was aligned with Royal Prince Alfred. And I came here as an intern and then again as a resident, somewhat against my will, but again, once I got here, discovered that I think I'm a country boy at heart, even though I grew up in the city and by the beach, and found that the society and the care that I was able to give my patients and the impact that I was able to do was a lot higher here in Dubbo than what I could do at a tertiary city hospital. So through my training, I then elected to do as many rural rotations as I could. And when the time came to looking for a position as a consultant, really my wife and I were looking outside the city because there were more opportunities. We felt that we could make a bigger impact, and we also found that we could live in the same town, be 5 minutes from work, and be able to leave at 5 and be home at 5:05 and spend family time together. So that worked really well for us.
What clinched the deal though for choosing Dubbo?
So Dubbo trumped the other sites really because of its collegiality amongst the medical staff. We felt really at home here, almost amongst friends straight away with my other medical colleagues when we were looking for positions and towns to live in. We liked the atmosphere of the town as well. It was very laid back, really can get from anywhere to anywhere else within 10 minutes. There's a very large shopping centre and a fairly vibrant cafe scene and lots of really beautiful places for my son to play and enjoy.
So you're a dad of a 1-year-old.
Yeah.
Did you ever think you'd be raising a family in a rural town like Dubbo?
Look, not growing up, I always imagined that my own upbringing was in the city, that I'd buy an apartment and my son would grow up in an apartment in the city, and we would do that over and over again, and my son would grow up in the city too. So it was a bit unexpected, in retrospect, to have my son grow up in a country town. But now that we're here, I can't think of anything better. We live on a very large property for a fraction of the cost of an apartment in Sydney. My son can run around outside every night. It's relatively warm here in Dubbo, even in winter, so we can play outside after work. We can raise chickens. He can go collect the eggs. He can ride his bike with Daddy pushing him around the yard and around the street with no problems. And there's plenty of opportunities for daycare, where I know my sister-in-law is really struggling to find adequate daycare for her children in Sydney. So it's really very easy to raise a child here in Dubbo.
And schools, education-wise, have you had any thoughts about that yet? Probably a bit early. But
yeah, we're about 10 years off thinking about high schools, but there are lots of educational opportunities in town in terms of primary schools and high schools, both in the public and private sectors. Recently, I've noticed that the public high school has a selective stream, a virtual selective stream, which I'm quite interested in exploring further, and there are also several very good private schools in town with academic excellence and a lot of sporting activities which you can partake in.
So as a clinician, what impact has working in Dubbo had on your career standing?
Look, I think my career has advanced a lot quicker than it would have in the city. So I'm 35, I'm now in my 4th year of being a consultant, but I sit on a lot of very important district panels. So I have direct access to the CEO of the organisation. If I have an idea about how to improve services, I can implement that fairly easily, and I'm the head of the department, but also chair of the clinical stream in cancer services across the LHD. And so my career has evolved fairly rapidly, and I know that if I did ever want to move elsewhere, the things I've been able to do would definitely hold me in good stead for a managerial position and a clinical position in those city or other rural hospitals.
Did you ever dream that you'd be this far along?
No.
Making such an impact?
No, I really didn't. So I never thought that I'd be involved in all these sorts of committees and changing policy at such an early stage in my career. And I never really imagined myself being able to implement programs which are actually impacting on cancer services across the LHD. So recently we've been able to introduce a video conferenced chemotherapy across the local health district so that people can get chemotherapy closer to home in towns like Coonabarabran and save them a 300-kilometre trip for simple treatments which they otherwise would choose not to have.
So you do a lot of outreach as well to Western communities?
Yes.
Tell me a little bit about that.
Oh, look, the outreach is probably the most fun part of the job. So I now do 4 outreach clinics. So one in Mudgee, which is a town of about 10,000 people, a wine district. So a lot of nice Christmas presents of wine from my patients. But I also get to go to Walgett, Coonabarabran and Cobar, which are smaller communities with lower socioeconomic status, lower health literacy and poorer health outcomes, where we've done some research, some health service research, and we've been able to improve access to cancer services 2.5-fold purely by opening up a second monthly outreach clinic. So being able to do that means that people who would otherwise choose essentially to die in their communities are now receiving treatments and extending their lives, and possibly even getting some cures because of adjuvant therapies which they otherwise would have elected not to have.
That's fantastic. So what does the redevelopment that's currently underway here at the hospital, the health service, what does that mean to the region and to cancer services?
Yeah, so Dubbo Hospital at the moment is undergoing almost $250 million worth of infrastructure redevelopment, not just in cancer services but across the gamut of specialties including internal medicine and surgery. Look, what that means is that we're able to provide a lot more services closer to home. We're expanding the chemotherapy unit from 8 beds to 16 chairs, which means that the wait times for chemotherapy will reduce. We're also improving our telehealth link so that we're able to provide more tele-oncology to remote communities and more treatments even closer to home than Dubbo. And we're also getting a linear accelerator and a PET scanner, which are facilities not available in the Dubbo local area at the moment. So that means that the radiotherapy utilisation rates and treatment rates for cancer will go up, and we'll be able to diagnose people closer to home, potentially taking away the needed trips to Sydney, which for people living out here is very difficult, not just financially but emotionally.
Would you call Dubbo Hospital an opportunity to practice frontier medicine? That's a terminology I've heard recently.
Look, I think frontier gives images of the Wild West. It's not quite that extreme, but it's definitely you get to treat people who do not have the same access to treatment as you would have even in other regional towns, and definitely not the same as you would have in metropolitan areas. In Dubbo, by being here, you're able to make a real impact on people's care. In most cases, in most specialty areas, you'll be the first of your kind, or in some other specialties, the second or third. But the number of doctors that we have here at the moment are not enough to serve the needs of our community. If you come to Dubbo, you will make a significant change, a real impact in people's lives. And that's much better than being the 23rd medical oncologist at a quaternary treatment centre in inner Sydney.
That was really good.
Cool, thank you.
Do you want to add anything else?
I think the move to Dubbo has been probably the best decision of my life, not just from a career perspective, but from my family's perspective as well. I'm really able to spend a lot of time with my son that I don't think I would be able to because of the commutes in an inner Sydney or inner Melbourne. And I'm able to get to spend a lot more time with my family and a lot more time with my patients because I don't have to do those awful commutes across town.
Okay,
Great,
great.
thank you. Now, do you want me to do the
Yeah.
Dr. Florian?
Sorry.
Oh, sorry. Yep. Cut. All right. Hi, I'm Dr. Florian Honeyball. I'm the medical oncologist here at Dubbo Base Hospital. If you're looking for a challenge, we're building a new hospital and an integrated cancer centre right now. There are plenty of job vacancies for all specialty types, including medical oncology, haematology and radiation oncology. So if you want to make a difference, I suggest you move to Dubbo, and that could be the only move you need to do to make a real difference. Okay. So we're just going to pretend that we're talking about things and be as sad or as happy as you want to be.
Sure. No, I'm really happy to be sitting here.
That's
It's a very comfortable chair.
It is a very comfortable chair.
It's wonderful.
So,
Yeah.
They go back and forth as well. So
Yeah.
if you want to have a play with it a bit later, I'll let you do that.
Fabulous. Thanks, Florian. I appreciate it.
Okay.
Yeah.
We won't put the drip in just yet.
Okay.
But afterwards, if you're keen, I'll get one of the nurses to stick a drip in and then maybe